Hot flashes, night sweats, feelings of depression, and hair loss. What do they all have in common? Hormone imbalances. But what made them fall out of balance? And what is the best way to test for these imbalances? We're going to talk about that and more today at Sunflower Shop. The subject of hormones is a big topic. Whether we're talking about PMS, menopause, or thyroid problems, many women don't know where to start. Joining me today is Dr. Mary Ann Block, founder of the Block Center in Hurst, Texas, and she's here to help us piece things together. Thank you for being here today, Dr. Block.
Thanks for having me, Brian.
Let me ask you, I have many clients who are suffering from hot flashes and night sweats and feelings of depression. What are some of the underlying causes of hormonal imbalance?
Well, unfortunately, women can have hormone imbalances at almost any stage in their life. When they're teenagers and they're just starting their cycle, they can have imbalances there that can really cause them to act like teenagers. Since I think sometimes when we refer to people as that, it's really their hormones that are causing them to act that way. And then, of course, pregnancy changes our hormones tremendously. And after pregnancy, when things are trying to balance back out and normalize, for some women that doesn't happen. And while many will get diagnosed as postpartum depression because they feel depressed, it's really not depression, it's a hormone imbalance. And so I feel like it's a huge disservice to women to give them an antidepressant instead of balancing their hormones. And they deserve to have their hormones balanced. And then, of course, as we get older, we get into a menopausal situation. Our hormones start leaving us dramatically. And at each of those stages, it can affect other hormones in our body, like our thyroid or our adrenal gland, because they all work together. And people don't really know that cholesterol is a precursor to all of those hormones. And high cholesterol is really a symptom, it's not a disease. And so as we get older and our cholesterol goes up, it may just be because it's trying to make more hormones. And so the body works great when we give it what it needs and take away what it doesn't need. And so we have to consider many different things when we're looking at hormones.
So testing for hormones, I know most people know about blood testing to get most hormones checked, but what other types of tests should people be getting?
Well, if they're premenopausal, I like to do a saliva hormone test because they can spit over a period of time and we can get a whole look for the whole month of what the hormones are doing rather than just one moment in time. And once they're in menopause, then a blood test makes more sense because the hormones aren't changing that dramatically.
With the different types of hormones out there, we had years of HRT, now we got bioidentical hormones. And many people are asking, what's the difference?
Well, there's a huge difference. Now, hormone replacement therapy, or HRT, can be bioidentical. But what bioidentical means is that the hormones biochemically look exactly like the hormones in our body. Where previously HRT may have meant horse urine estrogen, or a progestin, which looks nothing like real progesterone. And when they did these studies a few years ago and found that women who took HRT were at higher risk for heart disease, stroke, dementia, things like that, women panicked and stopped taking their hormones. But the study was done with the horse urine estrogen and progestins, not the bioidentical hormones.
I'm sorry, progestin and progesterone are two totally different things.
They are completely different. If we look at their biochemistry, progestins really look nothing like natural progesterone. And even pregnant women who need progesterone to carry that baby to delivery need progesterone, but they cannot take progestin because it's dangerous to them at that stage. So it's a huge difference in the two products. And it's important to know that if logically, those natural bioidentical hormones were going to cause problems, we would see them more frequently throughout our lives and not just later. Of course, too much estrogen for any woman, even the natural estrogen, even the estrogen in our body, too much estrogen for the progesterone we have puts us at risk for hormonal cancers like uterine cancer and breast cancer. So I think it's really important for every woman to know her balances and make sure that she doesn't need a little extra progesterone to offset too much estrogen.
So what types of nutritional supplements would you recommend to help support a healthy hormone balance?
Well, there are certain supplements that I recommend for everyone for life, and certainly women are part of that, and that's magnesium and essential fatty acids and the B vitamins. And those also are particularly beneficial to someone who's maybe menopausal because those hot flashes are really more neurological, and the B vitamins help calm down that nervous system and can be very beneficial for that.
Dr. Block, that is some great information. Thank you so much for being here today.
Thank you for having me.
If you want to learn more about hormones or other health topics, come see us at Sunflower Shop, where great health is just a way of life.